do all of this. It moistens the chyme, it assists in buffering the acids, keeps everything moving along, and keeps it all suspended in solution. Because by the time you get into the small intestine, there's usually not any solid stuff in your chyme at all. It's just water. It's probably kind of greenish colored, but it's just water. There's no solid stuff in it that you can really see. So when this chyme all arrives in the duodenum, there's some little contractions, a little peristalsis that's pushing it on downstream, right? And you can hear your intestines churning at night if you've eaten a fatty meal for sure. And that's just pushing it on downstream. Most of this is just all on its own. It's not controlled by your brain. It's not really controlled by your rest and digest stuff. It just happens because the bowel, if it has stuff in it, it pushes it on downstream. It's just kind of that simple. Parasympathetic stimulation can make it go faster, and you guys have all had these yucky feelings sometimes that then suddenly you have to go to the bathroom really quick. That's what it's talking about down here.
So main training plexus is by own, is not from the CNS. Main training plexus.
The splenic plexus?
No, main training. If you go main training reflexes. So
myenteric. Myenteric just means the reflexes that are in those little nerves that run between the layers of the muscle of the intestine. Yeah. And they're pretty much just acting on their own. It's not a big deal. You do have a couple of them here that you've probably experienced before. The gastroenteric reflex, if you're feeling ill, usually you'll probably get diarrhea because you'll have these feelings and everything is kind of passing through your bowel. There's another one called the gastroileal reflex. Now let's think about that. Gastro to ileal reflex. You guys have all felt that one too. I'll bet there's not a one of you who hasn't eaten a big Thanksgiving dinner and you've got too much food in your stomach and you kind of push back from the table a little bit and you got to get up and go to the toilet. And the reason you do is because of this reflex right here, the gastroileal reflex. Your stomach is saying, we got too much turkey in our stomach. It's time to get rid of it. And so it sends a message called the gastroileal reflex to the ileum that says to the ileum, start pushing stuff into the colon, get it out of there because we got more food coming. And so oftentimes it's kind of a natural reflex that happens and you suddenly have to go to the bathroom, and you do. Yeah?
Are these reflexes also triggered by things like Crohn's or like...
I wouldn't say they're Crohn's that's a disease of the intestine, so that's kind of not a reflex.
People with like Crohn's and stuff like it's like the same thing.
They're going all the time.
Yeah.
Yeah, that's because they usually have narrow spots in their colon or bowel, and whenever the food is obstructed and trying to push through, it peristalsis that much harder to get it through, and that oftentimes leads to cramps and so forth. Yeah.
So is it like kills the peristalsis more, like to release the feces?
Yes.
Like gastro reflex is like when they relax the muscle, it also tells makes the peristalsis.
Okay, wait a minute. Start again.
Okay. The gastroileal reflex.
Yes.
It makes peristalsis, controls peristalsis.
Well, it doesn't control it, but once in a while it triggers it.
Oh.
Yeah, it triggers it to see it. First of all, it says relax the ileocecal valve, which is this valve right here, and start pushing this stuff out of the ileum on into the colon. Okay? Let's talk about the pancreas for a minute. The pancreas, I showed a number of you the pancreas in your cats the other day. Your pancreas lives right in this loop along behind the greater curvature of the stomach, extends out here to where the spleen lives. A pancreas, it only has openings up at this one end where it enters into the duodenum. It's pretty well stuck in the back of the peritoneum. It doesn't really have a serosa on it, just some kind of adventitia like y'all have talked about. The pancreas, for you splitters in the crowd, has a head, a body, and a tail. Enough said. The pancreas itself, you need to look at it under the microscope, because what you'll find is the pancreas is mostly, about 99% of the pancreas is made up of these lobules of pancreatic tissue that we'll talk about. There are these partitions that occur between it, so there's connective tissue running down and kind of dividing the pancreas off into pieces. But most of the tissue of the pancreas is these acini, the pancreatic acini, and they're nothing more than little cul-de-sacs. So there's a little cul-de-sac that looks like this, and these are all pancreatic secretory cells that live around here, and they're all making juice, pancreatic juice, and it's coming out in here, and then these guys are hooking up with other cul-de-sacs and so forth. So this whole area just becomes a bunch of these simple columnar cells, not columnar, cuboidal cells, that are making pancreatic juice, which has all these enzymes as well as bicarb in them. Scattered within the pancreas, there are occasional little islets of tissue that look clearly different than this stuff out here. And they are called the pancreatic islets. It's one of the most common questions on Jeopardy. It comes up about every 4 weeks. It's under the geography section. They always ask it. They're trying to be tricky. So they say, where in the world are the islets of Langerhans? Yeah. And that's the pancreatic islets that occur here. It makes up only about 1% of the whole pancreas, but you can clearly see them under your microscope. Here's one, here's one, here's one. So here's kind of what the pancreas itself looks like. Here's the duodenum over here. Here's the duodenal papillae. Here's the main duct of the pancreas that enters right there. Occasionally, people have an accessory duct, but just ignore that. Don't worry about that. It's very rare. Only about 5% of people even have one. Notice that the common bile duct, which is illustrated here in green, is coming down, and it meets up right here at the, pretty much right at the duodenal papillae, and so you have this common channel of both pancreatic secretions and bile going into the duodenum there. Now the pancreas lays across the midline, and I would say that in my career I found I had 4 patients that came in after a car accident who had had a seatbelt on, and they got thrown into the seatbelt really hard, and that it's just like giving yourself a big karate chop right across the upper abdomen there, and it can actually cut your pancreas in half. So pancreatic transection due to blunt abdominal trauma is really common, and it just cuts it in half right across here. There's nothing to do but you just take out the tail and oversew the end of it, and patients do just fine, as long as you made the right diagnosis. As long as you operate on the patient, and when you got in there, you knew what the hell you were looking at, and then you could fix it. So those are the kind of issues. But yeah, pancreatic transection due to blunt trauma is not uncommon, and the reason it divides it right about here is because that's where the backbone is. Your vertebral body's just sticking up in there.
So it just pushes it.
Yeah,
Pops off.
exactly. So here's a picture of the pancreas. This is kind of a schematic over here. This is all these little cul-de-sacs over here that you're seeing. This is 99% of the pancreas, and then every so often there is pancreatic islets. And here's a microscopic picture of the same thing, and here's one islet right there. All the rest of that picture is these acini that are making pancreatic juice and making pancreatic enzymes. What are the functions of the pancreas? Well, the endocrine cells of the pancreas make insulin. And insulin is the drug that keeps you from having diabetes. If you don't have enough insulin, you've got diabetes. There's 2 forms of diabetes. One is a disease that's called, we used to call it childhood diabetes or early onset diabetes or
Insipidus?
no,
Insipidus and
not
mellitus are
insipidus.
two different
Totally
things.
different. Not insipidus. We'll talk about that later. But diabetes mellitus, if it occurs in childhood, it usually occurs all in one day. A kid gets a virus. He goes home from school on Friday. He doesn't feel very good. By Monday morning, he's in the emergency room in a coma because every pancreatic islet in his body was destroyed, was killed by the virus. From that day forward, that kid makes no insulin at all, and he has to take insulin, and he has to take it around the clock. Usually, these are the kids that usually end up with a pump to pump it in there, and because they need it all the time because they're not making any. The most common kind of diabetes, and the one that's overwhelming this country's healthcare system, is type 2 diabetes. And type 2 diabetes is caused by the fact that in heavy folks, our fat makes an anti-insulin factor called leptin. Leptin is an anti-insulin drug. So if you have too much leptin being made here, it fights the insulin that your body's making and you become diabetic because you don't have enough insulin that way. The advantage of having type 2 diabetes is that you can take pills that stimulate your own pancreas to release more insulin. They work pretty good. Later, if it gets worse and worse, however, you do end up having to take shots of additional insulin to keep your blood sugar under control. So that's probably the number one function of the pancreas, is making insulin. It also makes glucagon, and glucagon, let me just tell you that glucagon is almost exactly the opposite of insulin. Whereas insulin brings your blood sugar down, glucose makes your blood sugar go up. And that's really important because if you go 10 hours and you don't eat anything, and all the sugar in your blood is gone, it's nice to have this stuff called glucagon because it can be released and it will push your blood sugar up and you won't get hypoglycemic, which is what low blood sugar is. So know that insulin lowers your blood levels, the blood level of sugar. Glucagon raises it. The rest of the pancreas, the 99% of the pancreas, is involved in making pancreatic juice. And pancreatic juice is full of all of these enzymes that we've been talking about. Usually the precursors of the insulin, of the enzymes, like trypsinogen instead of trypsin. It doesn't become active until it gets out in the intestine, and so forth. Our pancreas makes about a quart a day of juice. Yes?
I just had a really quick question. I had a friend in high school who had type 1 diabetes and played water polo with me. He would always get really low energy and have to get out and eat something sugary.
Right.
So I'm confused because in type 1 they're not making enough insulin.
Well, he was taking shots.
Yeah.
And later in the day that shot was acting to push his sugar down.
Oh, okay.
And that's why with these kids that have this, it's such an incredible balancing act between eating and taking insulin, and exercise will burn up more sugar, and everything has to be balanced. Now, just think about how far we've come, because when my grandfather, who had type 2 diabetes, but was a pretty severe diabetic, the only way he could check and see what his blood sugar was to do a urine dipstick. So he would pee in a jar every morning, dip a stick in it, and if it could read 1 plus, 2 plus, 3 plus, or 4 plus sugar. And then based on what that said, now really remember that by the time it gets to your urine, it's already 4 hours old information, right? Because it's sat there in your bladder mixing with all the urine. And then he would pull that, and that's how he would decide on his dose of insulin for the day. Now, finger prick, 1 drop of blood, within 3 seconds you have a glucose number. That's a pretty good deal. And that tells you truly what your blood sugar is, and then you can use that number to determine whether you need to take more insulin, less insulin, eat more food, or whatever. But diabetics usually always carry candy around because if they start getting hypoglycemic, they start getting out of it, and they learn what that means, and they take a little sugar. Yes.
That's like when it comes to like the whole low blood sugar thing, if you're taking insulin, so it's why it's very key to test your blood sugars before you eat a meal, so you know your blood glucose levels are at. So then like you give yourself done, like if you have like the Novolog pen, the Nova pen or whatever,
Right.
that is, you give an amount based on what your current level is, so when you eat, it doesn't
Right.
go too low. But
The problem with all of this is, but diabetes is a really complex disease that we really do understand very well, and we have these amazing tools that can fix it. The problem is keeping the patient motivated for the next 60 years to do that before every meal and every night before they go to bed. And that's really probably the number one thing that of patient education that nurses do, is they always are trying to teach the patient how to understand their diabetes better. Yeah.
How does gestational diabetes work?
Well, that's gestational diabetes. Just means that you
Why?
you just have a huge additional stress on your body called pregnancy,
Yeah.
and that huge additional stress means you need more insulin than normal.
Okay, so it's in most people, or in most pregnant women, the pancreas picks up the extra load and produces
Absolutely.
it, but in some people it just doesn't.
Especially if somebody was nearly or almost a pre-diabetic anyway, then gestation will push them over and make them a real diabetic. Yeah.
All right.
So lots of juices here. I told you already that the secretin was that hormone secreted by the duodenum that will put you into that. There's all these pancreatic enzymes as well. Just some words you probably ought to know. Anytime you see the word amylase, that's something that breaks down carbohydrates. Okay, breaks down starches. So remember the story I told you about putting the saltine cracker in your mouth. That's from amylase that's secreted by your salivary glands. It's similar to salivary glands. There it says it right there. Pancreatic lipase also breaks down these complex lipids, and it breaks them down from fats to fatty acids. And those fatty acids then can be pretty easily absorbed across your intestinal mucosa. Nucleases, just a fancy word for an enzyme that breaks down DNA and RNA, the two ribonucleic acids. And then there's all these proteolytic enzymes that are going to break down proteins, proteases, peptidases, and so forth. Most of what we make here, 70% of all pancreatic enzymes, is these proteolytic enzymes to break down protein. Now, one of the real important things to realize is that all of these enzymes are secreted as these inactive proenzymes. That person that got their pancreas cut in half started releasing pancreatic juice out into the back of their belly. Well, those enzymes are eventually going to be activated, and they're going to start digesting the person. And that's not a good deal. That's why pancreatitis is such a terrible disease, and also why any trauma to the pancreas is so critical that it needs to be identified and treated appropriately the first time, because you come back 12 hours later and it's like you dumped a bucket of acid in the back of somebody's back, because the pancreas will just eat you alive. It'll eat you up. Okay, let's move along here and talk about the liver quickly. The liver is our largest visceral organ, the largest organ in our body. It weighs about 3 pounds or so. Lies up here in the right hypochondriac area. Hypochondriac, what does that mean? No, hypo is below, and chondriac means cartilage. Remember all these cartilages that are here that hook together? That's the hypochondriac, and that's also why we name people that are crocs hypochondriacs, right? I don't know what the relationship there is. People, oh, it hurts here. Yeah, I guess. Anyway, that's a confusing word. And then the epigastric area is right up here, epigastric, above the umbilicus. Yeah. Read your shirt. Okay. So there you go. What does the liver do? Well, let me just say that the way I think about the liver is liver does two main things for you. It makes stuff and processes stuff for you. In other words, it cleans out all the stuff out of your blood. It manufactures most of your proteins. It makes most of your albumins, makes most of your globulins. It makes most of your blood clotting factors. It makes, and it also breaks down a lot of poison kind of things that you don't want anymore. Okay? The second thing that the liver does is it makes bile. And bile is this green liquid. It is full of bile salts. And bile salts are made by the liver and dumped into the bowel right here after going past the gallbladder. And they act to emulsify the fats in your chyme. Now, what does that mean? Well, let me go over that in a minute. Anyway, don't get too far off what I'm supposed to say here. The liver is a little tougher than your pancreas. It has a pretty firm capsule around it, but believe me, it can bleed like hell. And the problem with the liver, as you remember from your vascular anatomy, that the vena cava, the inferior vena cava, comes right up through the middle of the liver and has all these little branches that feed from the liver into the vena cava called the hepatic veins. And if they get torn in the process of a car accident or a deceleration fall from a ladder or something, you tear those veins, they're down within the liver, it's really hard to get control of them. So people do die from liver trauma frequently. It's a common cause of bleeding to death because your liver, it just fractures, it kind of cracks, and then it's a big deal.
I had a friend in high school whose horse rolled on top of her.
Not a good deal.
No, and she spent 2 months in the hospital because every time they thought they got it under control, she'd
start
start
bleeding again. Yeah. So here it is, running right here through up through the inferior vena cava, coming up through the liver. Really, more like over here would be a better drawing, I think. Here's your aorta. Here's the liver. What's this thing up front? Remember? Falciform ligament that used to be part of the connections up to your belly button, to your umbilicus, your
Ventral mesentery.
part of your ventral mesentery. That's correct. The other part of your ventral mesentery that is illustrated here is this thing right here, which is called the lesser omentum. And the way to picture this is if you think about the stomach, if this was all lined up, the stomach would be right here. It would be lined up like that. So this would be coming down from the ventral surface. But because of the rotation of the gut and the duodenum and everything, the liver kind of rotates that way, the stomach kind of rotates this way, and that's why the lesser omentum is where it is. And yet it still carries the blood vessels to the lesser curve of the stomach. Here's the stomach right here. Here's the lesser curve. This is the greater curve over here. Okay? The liver is, the book, I was actually reading the book last night, and it said the liver has four lobes. There's a right lobe, a left lobe. There's a quadrate lobe down here, and sometimes there's like a center lobe or middle lobe. It's enough said. Just know that it has a few lobes. And your cats have lots of lobes. They like have 7 or 8 sometimes. Doesn't mean a thing. Here's the falciform ligament running here. The round ligament runs along with it. That's what used to be the old ductus venosus that we talked about. If you look at it from the back, it looks more like this. There's that vena cava going right through the liver, and there's one vein, but there's usually about 5 veins that come off and go into the liver. That's all kind of within the liver itself. So, the liver makes bile, as I said, and bile collects, and it comes down and forms the common hepatic duct. I've got better pictures, I'll show them later. I won't go over that right now. Okay. Now, the liver takes a huge amount of your blood. That's because it does a lot of work on it. It manufactures all those proteins, it breaks down the bad stuff, and about 1/3 of your entire, let me summarize that by saying the liver gets a lot of blood. It gets blood from two different sources, however, and this is something that you really need to understand, because otherwise when we get to the microscopic of the liver, it won't make sense. The liver gets about 1/3 of its blood supply from the hepatic artery proper. Now what does that mean? Well, that means the hepatic artery, which comes off of the aorta as part of the celiac trunk, and then the celiac trunk gives off the gastric artery to the stomach, the splenic artery to the spleen, and the hepatic artery to the liver. It's bright red oxygenated blood that comes to you from your hepatic artery proper. But 2/3 of the blood that goes to the liver comes from the hepatic portal vein. And be careful when you name that, call it the hepatic portal vein, okay? It'll become obvious why I say that. But about all of this is venous blood that should be heading back to the heart, right? Should be heading back to the vena cava and going back to the heart, but it doesn't. And the reason it doesn't is because this is blood that has just collected all of these nutrients. This is the blood straight from the large intestine, small intestine, stomach, and esophagus. All of those are your intestines, right? And so that's where most of your proteins, sugars, fats, and so forth have been absorbed right into the bloodstream there. And the best place to send it to is straight to the liver. And so that's what our body does. It puts all of that venous blood, puts it into the hepatic portal vein, and sends it straight to the liver. So you have two groups of blood going into the liver. One is red blood from the hepatic artery proper, and 2/3 of the blood that's flowing to your liver all the time is venous blood coming from all the intestines. I'll show you pictures in a minute. The liver lobules, basically a lobule is the basic functional unit of the liver. We have about 100,000 of them. You don't need to know the name of each of them. They're about 1 millimeter in diameter. And believe me, if you look at a living liver, in a human at least, and you kind of bend down and look close, you can see these lobules. They're just little dots, but you can see that they're different on the liver. So they're about 1 millimeter in diameter each. In cross-section, they're hexagonal. And so what that means is one liver lobule will be shaped like this, kind of like a beehive stuck together. And there are 6 of these areas around them that we call hepatic triads or portal triads. And the reason we call them triads is because they have 3 things in them. I was just going to say that.
What color
I know.
says so?
There is an artery going to each portal area. It's called the hepatic artery that we just talked about. There is a hepatic vein, not a hepatic vein, excuse me, a hepatic portal vein that's coming from those intestines, bringing that heavily enriched blood from the intestines. And then there's one thing leaving, which is called a little tiny bile duct. That's right. So you need to know the 3 things that are in each one of these. So there's 3 of them in here, and there's a hepatic artery, there's a hepatic portal vein, and there's a bile duct in here. Bile duct is leaving, the other 2 are arriving. And these are easy to see under the microscope. You'll see these and be able to identify these triads without much trouble. So these portal areas each contain 3 structures: a branch of the hepatic portal vein, a branch of the hepatic artery proper, and a small branch of the bile duct, which is where the bile is secreted and it's going to start collecting and get bigger and bigger. Here's a nice picture of it. Here's the triads out here around the outside. Here's blood coming in from the hepatic portal vein, illustrated in blue out here because it's very blue. It's already been through the capillaries, remember, of the intestines and coming here. And then there's a hepatic artery, which is bright red blood coming out of the aorta, coming off of the celiac trunk, coming off of the hepatic artery proper. And then you notice that there's a little bile duct that's leaving here. And the way this stuff comes is the blood comes in here through these two structures, and it percolates here in through the lobule. These are called sinusoids, that's right. And basically they're just nothing but empty cavities that are surrounded by hepatic cells. So the blood dumps in here and it's processed through these hepatic cells, and it takes what it wants out of the blood, and it creates bile, and the bile then is created and it feeds out here into these little bile ducts, forms these little bile canaliculi and so forth. And then the rest of the blood pours here to the middle of these triads. This is called a central vein. And the central vein are the ones that all come together and form those big hepatic veins that go straight into the vena cava within the liver itself. So the blood comes in from two directions, artery and portal vein. It goes out through the central veins, which then become the hepatic veins, dump right into the inferior vena cava and go back to the heart. Okay? A close-up of this, a little closer maybe. Here's the two blood systems coming in. They run up here through all these hepatic cells, and the bile is created by these hepatocytes or hepatic cells, and it's put into these bile canaliculi, and they get pulled together and come out of here as little tiny bile ducts, as illustrated right here. There's also another group of cells in here in the liver called the Kupffer cells, K-U-P-F-F-E-R. These are nothing but macrophages that live in the liver. So these are the guys that go around and scoop up and kill things and eat them up that don't need to be there. Here's what it might look like under your microscope depending on what kind of stain you have. This is a big vein. You notice it's got blood cells in it. It's not round. Here's an artery. It's nice and round. Has that elastic membrane, you know, that squiggly one. Yeah. And then here's a little bile duct right there coming out. All the rest of this is all just blood cells and liver and sinusoids full of blood everywhere else. I think I've said everything on here, so I'm going to go through it. What is this bile stuff? Let's talk about bile for just a minute, because basically the bile canaliculi run between the liver cells. So the blood kind of comes in on one side of the liver cells and bile kind of goes out on the other side. And as it produces this bile, then that bile collects and it's going to eventually go down and dump into our intestine right there, like we talked about. Now, I think the anatomy of the bile duct system is pretty important, mainly I guess because I used to operate on it a lot, but you do kind of get used to talking about it. So let's talk about it like this. Let's say this is the liver here, and let's say that the right lobe